Welcome to episode 28 of Bonding and Beer. This is your host, Rolando Nuñez. And today's topic is intraoral repair. Let's go! Well, my dear followers and my dear subscribers and everybody who's listening to this, the question has been brought up again. What has Rolando been up to? Well, let me tell you, I haven't traveled much, which is a good thing. I have something that people call a side hustle, and you probably are aware. I have a food trailer, a little food truck. So we went to our very first food truck festival. It is called the Lake County Food Truck Festival in Grace Lake in the Lake County Fairgrounds. It was awesome. About 40 food trailers and food trucks, a lot of food, a lot of beer. There was live music. I want to say close to 2,000 people. It was absolutely fantastic. However, let me tell you a story. This is our first time doing this. We have a large smoke extractor, but also grease extractor, okay? You turn this thing on, and it starts making a lot of noise, and it's just going to take all the smoke from the food trailer and all the grease. This thing broke down. The switch to turn it on broke down. But we said, well, we just open the doors and the windows, and we'll be fine. My dear friends, by the end of this day, everything was covered in fat, in grease, everything. I was glistening. Adriana, my wife, was glistening. It was crazy. And all because we were not able to turn on this thing. Now we know, right? But it was crazy. We had to power wash everything, and we broke a bunch of stuff. It's just a fantastic journey. However, we were able to sell everything. All the burgers we were out of burgers. And this thing ended around 9 p.m. We were out of burgers by maybe 7. There were people that were in line, and they got hangry. And one guy came to me and said, hey, man, what do you mean you ran out of burgers? I'm like, I ran out of burgers, my guy. What do you want me to say? Well, don't you know how to plan? And I'm like, apparently not. Apparently not, okay? Don't be a hater. This is my first time. I brought 200 burgers. I ran out. Well, maybe next time you bring 300. So, hey, I'll see you next year. You know what I'm saying? Okay, man, so let's get into the topic, okay? We're going to be talking about intraoral repair. And intraoral repair is it's a procedure that some people don't like to tackle. They prefer to just change things, okay? However, there's always a possibility to do a repair, okay? Now, we're going to discuss why repair, why do you need to know how to repair, and why should you do it. We're going to discuss when to repair, because not everything that looks like you can actually repair it is repairable, all right? Sometimes things need to be changed, and we're going to discuss that. But most important is how to repair, because there is a very specific protocol when you're doing an intraoral repair, and also when you're doing mixed substrates, repair of mixed substrates. When you have feldspathic porcelain and exposed metal, there is a protocol for that, okay? Very, very specific. We're going to discuss all of that. But before we go any deeper in this topic, let's open a beer. Let's crack it open and see what's what. So today's beer is called Steve Austin's Broken Skull IPA. This is brewed by El Segundo Brewing Company. It is an IPA with 6.7% of alcohol content. And the description of the beer is, it says, an IPA designed by Steve Austin and El Segundo Brewing for the working men and women, delivering big flavor with an easy finish. That's super interesting. That's super cool. Jeremy, the producer, tells me we're doing Steve Austin's Broken Skull IPA. Now, you need to understand this. I could be Jeremy, the producer's dad. That's how old I am, and that's how young he is, okay? And he says, Steve Austin. Where does my head go? $6 million man, Lee Majors, from the 1970s, okay? It was a TV show. Maybe it was on ABC or CBS. I don't remember. Lee Majors used to be the husband of Farrah Fawcett. I don't even know if Lee Majors is still alive. And then he goes like, no, it's Steve Austin, the wrestler, the WWE. And I know that it's Steve Austin too, but my brain went to the $6 million man. I think that's interesting. We have different point of views regarding the same celebrity. Let me put it that way. Those of you who are listening, this can is super interesting. It's kind of like light tan with a lot of brown, okay? The main image in the front of the can, it says El Segundo Brewing Company. The letters are kind of like broken bones. There is a skull. There is a description of there's a lot of barbed wire here, okay? And there is a signature of Steve Austin, and there is a snake. We're going to open this up, okay? We're going to open it up and see what's what. Let's open it right here. Oh, yes. Oh, yes. This is a typical IPA. The smell is a typical IPA. IPAs are citrusy. They are, very, herbal. They have this very natural scent, fruity scent, okay? It smells like a prairie. It to me smells like a pine forest. It's just fantastic. Okay, so we're gonna pour it right here. Yup, you see? All right, screwed it. I poured IPA all over my trousers over here. Jeremy, the producer, is laughing. Okay, because this is what we do. So we're gonna pour it. And this beer, you see? No botching it. A little bit of botching, but it looks nice. Very nice head. It is a little hazy, so we're going to smell it. Take a sniff. Yep. Smells fruity. Smells piney. Now let's give it a taste.
Sip, 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 sip.
I have to say, Jeremy, and I'm going to keep my comments until the end. In the description that you wrote, which was directly from the website, it said, IPA designed by Steve Austin and El Segundo Brewing for the working men and women, delivering big flavor with an easy finish. There's nothing easy about this finish. Nothing. Okay? Nothing. This is a hardcore IPA. It hits you in the face when you sip it. It hits you in your throat as you're swallowing it. And then it just lingers all over your mouth, the bitterness. This is awesome. There is no easy finish. Absolutely not. I don't even know what easy finish means to El Segundo and to Steve Austin. If by easy finish is Steve Austin cracking some skulls, and then yes, there are some cracked skulls here. It is a great IPA. I will give a full review at the end of this episode. Let's go. Okay, so let's discuss this intraoral repair. Let's discuss this, right? Why do we need to repair? Why do we need to know how to repair? Sometimes the restoration doesn't need to be redone just because there is a little bit of chipping in an incisal edge, or there is a little bit of, a small delamination where there is, exposed metal on a PFM. You can definitely do a repair if the fitting is fine, there is no leakage, occlusally is not looking bad, it's balanced, and if it also, if when assessing the failure of the restoration, if you feel as a clinician that you can actually do the repair and do proper contouring, proper anatomy, and proper aesthetics and function, and then you can definitely do a repair. Also, it is interesting to understand that every time we have to do a restoration on a patient, there is a financial burden. Not every patient that we see, at least when I practice, not every patient has, financial means to do whatever. Okay, a lot of patients that I saw in the little town where I practiced, they were like, okay, let me figure it out. And sometimes you will give them an estimate of what the full job was going to be, and then they will go and then come back a few months later with a down payment and, financing opportunities, financing options, whatever the case may be. So repairing helps your patients. I've heard some people say that, oh, it's just putting like a little Band-Aid. Well, sometimes a Band-Aid does the job. It helps. It helps keep going. Why repair? Because instead of changing, if you do the repair procedure, you're going to be able to save time, help the patient save some money, and if you do it correctly, that repair should last, a decent amount of time. A small chip on a restoration, but the restoration is perfect. That's when you repair. That is when you repair. A little bit of metal exposure, but the rest of the restoration is properly fitted in the prep. That's when you repair. In today's world, we can predictably bond to basically any substrate. Okay, we can bond to zirconia, we can bond to an etchable ceramic, we can bond to metal, we can bond to composite. Right there, that's pretty much everything. Okay, you can bond to the tooth structure, you can bond to the enamel, you can bond to dentin. So if you can bond to all of that, you can definitely do a repair. Okay? Now, when are we going to repair? And this is tricky. Okay, this is tricky. You gotta do a clinical assessment. You know what I'm saying? You have to be able to do a clinical assessment where you determine why that restoration failed. Okay?
Sip, sip.
It could be because the restoration has been in the mouth for 30 years. Okay, it's time. But what if the restoration has been in the mouth for only 3 or 4 years? And all of a sudden it broke, right? And then what do? Well, you got to make an assessment. You got to make sure you evaluate everything, right? Clinically. And one of the biggest things that people don't evaluate properly is occlusion. You need to understand if that restoration was properly balanced from an occlusion point of view from the get-go. And I'm going to give you an example. I had some veneers done by my wife, and she told me those are, when we try them in, she said, they're too long. We need to, do some adjustment. But we were about to get married. And I said, look, just do the cementation procedure and we'll do the adjustment later. She did the cementation procedure. We went through the wedding. And then the adjustment was never done accordingly because we moved to the U.S. I broke the incisal edge of one of those veneers. The veneer was perfect. It was my occlusion, because it wasn't properly adjusted, that led to that failure. So occlusion is a huge, huge component that will have an impact on the possibility of that repair to actually work and to actually stay in place and to actually be a successful treatment. You need to determine why that restoration is broken. And you can do that, all right? But you need to assess that, which is what most people will say, oh, I did a repair, but it didn't last long. Because you didn't assess, you didn't tackle the reason why the restoration failed. So when to repair? Whenever is possible, based on the condition of the restoration. But most important, you need to do the clinical assessment and tackle the reason that led to the failure of the restoration, okay? Also, you need to know what material you're going to repair. Nowadays, when you see a nice zirconia restoration, you might think, is this zirconia? Is this Emax? What is it? Sometimes the patient doesn't know, and sometimes you didn't do those restorations. It was done by somebody else, and you're going to repair it, and if it's zirconia, well, you can't treat it the same. You have to know what it is. You have to make sure that you're doing your proper research on finding out what type of material that restoration is made out of. So you can do the proper bonding protocol to that restoration, to that substrate. If you don't know, you're not going to be able to tackle the bonding accordingly. So you need to know very well. On top of everything else, the clinical assessment, the occlusal adjustment if necessary, the occlusal assessment, you need to know what the substrate is made out of. What is that substrate in order to properly bond? Now, here comes the best part. How to repair. How do you repair intraorally? So I'm going to share with you guys a list of things that you should have regardless of whether you're going to do a repair or not. I think you should have these things in order to be able to do solid dentistry. You need a sandblaster. Now, do you need a sandblaster that works with water, that you can do intraoral sandblasting? Do you need it? It will be nice to have. It's not mandatory. It's not of the essence, but it will be very nice to have because there are a lot of things that you can do with an intraoral sandblaster. Let's say you don't have a sandblaster. Well, you're going to need ultrafine diamond burrs to create mechanical retention on the restoration that you're going, on the substrate that you are going to repair. You're going to need silane in some shape or form. It's always best to work with standalone silane rather than some concoction that contains silane. It's always best. So you're going to need silane. You're going to need MDP. And you might think, well, Rolando, what do I need MDP to bond, if I don't have zirconia? Well, MDP doesn't only work on zirconia. MDP works on metal. And it works extremely well on metal.
Sip, sip, sip.
So your MDP is of the essence to have, okay? You're going to need a bonding agent of some sort. You're going to need a bonding agent, your dental bonding agent. You're going to need opaque composites because you have to, in some cases, you're going to have to mask whether it's metal or whether it's a really opaque substrate in the back. You're going to have to mask that if you don't want that to show into, to have an effect on the final aesthetics of your repair. So you're going to need opaque composites. And you're going to need restorative composites, okay? Whatever the composite of your choosing, whatever you have in your office is going to work. But you need opaque composites, okay? Now, it is important to understand that when you have an exposed metal and then you have porcelain, you have two different substrates. And that's the one we're going to tackle first. If you have a porcelain fused to metal restoration with exposed metal, you're going to repair it. It will be nice if you could isolate and then etch with hydrofluoric acid. If you can isolate with rubber dam, and then you could etch your porcelain. However, if you don't have that, you can take a diamond burr and just, smooth the surface. Almost like you're polishing it. Or smoothing the surface with a diamond burr. Ultra fine. You don't want to use something too rough, because if you do that, you're going to create a very rough surface, and you may incorporate cracks in the ceramic. You have to go really slow with water and create a smooth surface, almost like a bevel almost on the porcelain. The metal, yeah, you can touch it with a burr too. It's not a problem. But the porcelain, you need to smooth it out. Now you've created your mechanical retention. So once you're done with that, you're done with your mechanical retention, you need to prime the metal, and you need to prime your porcelain. Now, logically, you will start with the metal, which is in the back, and then you move up to the porcelain, which is in the front. Well, we're going to flip that. We're going to apply the silane first. Why? Because you don't want your MDP, your silane reacting with MDP. And let me explain what the problem is. Silane in low pH environments can deactivate, and you don't want MDP touching your silane and running into a risk of deactivation. Some people will say, oh, that takes time. Well, yes, but you want to avoid that. Okay, so what you're going to do is you're going to apply your silane first on your porcelain. What happens if the silane lands on the metal? Nothing. There is no reaction. But the silane that lands on the porcelain reacts.
Sip, sip, sip.
And now you've already bonded to your porcelain. Then you are going to apply your MDP to your metal. Rolando, the MDP is going to touch the silane. No, it is not. Your porcelain substrate has already been bonded to. There is no reaction between that surface or the silane that was placed on that surface and the MDP. That's why you go, let's say, you start from the front all the way to the back instead of starting from the back. You don't start with a metal, you start with a porcelain when it comes to priming, and then you finish off with your metal. Now, some people have asked me, can I use an MDP containing adhesive? Yes, you can, but you have to light cure it, okay? Any adhesive that has MDP, like All Bond Universal, you can use it. If your adhesive doesn't have MDP, then you're going to need to use a primer that contains MDP. You're done with that, okay?
Sip, 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 sip.
Now you're going to use an opaque composite. People put a bunch of composite, a thick layer, and then when the light cure it, the light doesn't go through it. And now you're going to have uncured composite or not properly cured composite in contact with your metal that you're trying to mask, and things are not going to work. Why? Because you put a thick layer, because you want to mask it all at once. It's opaque, and if it's light cured, it needs to be layered in thin films of composite for light to be able to properly cure. How do you solve this issue? You use a dual cure opaquer. There are some in the markets. Bisco has one, where you mix base and catalyst. It's dual cured, but it's opaque. And now you apply this with a bristle brush on the metal. And you can hit it with a light, but it's going to cure chemically. So it's not going to be an issue when it comes to polymerization. It's not going to be light dependent. And now it's properly cured, and by being properly cured, it's going to be properly bonded. I recommend the use of an MDP-containing primer and a dual-cured opaquer. And that way you're going to achieve the best bond possible. And then what do you do on top of that opaquer? Well, and then you can just start placing your composite. You start layering it like any other restoration. But that bond to the porcelain and to the metal is going to be extremely effective. And the fact that is dual cured, even better. How do you repair zirconia? Same thing. Just take a burr, do the same thing, okay? And by using the burr and keeping things isolated, you're removing any sort of contaminants, okay? Any sort of contaminants. Physically, with a burr, polish, perfect. Now you apply your MDP-containing primer, okay? Now you've bonded to the zirconia. And then on top of that, you can place an adhesive and light cure it, or you can place your composite. And that's okay. The Emax, same thing. However, we're going to use different things in order to achieve the same thing. You're going to use a little burr, you're going to polish it, and that's going to create mechanical retention. Apply silane. Instead of MDP on Emax, it's silane. And then after that, you could apply an adhesive and light cure it, or apply your composite directly. Either way, it's going to bond. The last one, a composite restoration. Can you sandblast it? That will be nice. I don't have a sandblaster. You got to use a burr. Same procedure. After you're done with using the burr, what are you going to do? Well, you are going to use a dental adhesive. Okay? You can use a dental adhesive, or you can use silane. Okay? If you use a dental adhesive, you have to light cure it. And then you move on with your composite. So I've gone through 4 different protocols for 4 different substrates. When you're repairing something, if there is tooth structure involved in the repair, then it's best to use a dental adhesive, okay? Now, I just want to tell you that here at Bisco, we look out for, the convenience. We consider the convenience factor extremely important when it comes down to putting together kits and developing products and all these things, right? We have an intraoral repair kit. And that intraoral repair kit contains all of the necessary components to do an intraoral repair. To wrap these things up really quick. If the restoration that is going to be repaired has been properly assessed from a clinical point of view, the repair should last longer than expected. As simple as that. Did I do a lot of repairs when I was practicing dentistry? No, but I did enough to understand what makes a repair last long. And to me, it was checking on that occlusion. And of course, knowing how to bond to different substrates. But checking on that occlusion is of the essence in order to make that repair more predictable and more long-lasting, okay? The other thing that you really need to know is to have a very thorough knowledge of bonding protocols to different substrates. If you don't know, you need to just, freshen up information. Send us a question. Ask a colleague. Whatever the case may be, make sure your protocol is fine-tuned, it is updated, and that way you're going to be able to provide the best repair possible when it comes to bonding. Look, man, this beer, this Steve Austin dude, this Broken Skull IPA, it's got to be one of the best I've ever had. It is so good. It's juicy. It's bitter. It doesn't have this easy finish. Absolutely not. This is what I think about this beer. It's great. It's awesome. Did it match the beer description? IPA for the working man and woman, delivering big flavor and with an easy finish. Nope, it did not match the description. There's no such thing as an easy finish. I don't know what these guys are talking about. This is a heart finish. Heart finish. You know what I'm saying? It's awesome. So I'm going to give it 75% accuracy on this statement, on this description. Beer rating 1 to 5. You know, one of the things that I'm going to start considering when I rate the beers is my ability to be able to have it again. And unfortunately, I'm going to give this one a 4.85. Okay? You know why? Because El Segundo has no distribution network in the magical state of Illinois. Jeremy, the producer, is correcting me live in this thing. Okay? And apparently, we can find Steve Austin Broken Skull IPA. Where is this from? Isn't this from California? I'm going to change my score to 4.95 because I can find it here at Binny's, which is our liquor supermarket. I don't give it a 5 because, the guys from, from Revolution probably call me and say, hey, what's going on? And I'm like, hey, man, we've been together for 10 years now. That's my number one IPA. Some marriages last less than that. You know what I'm saying? So El Segundo coming in hot. 4.95 to this Steve Austin's Broken Skull IPA. Would I drink it again? Well, I'm stopping at Binny's. That's for sure. All right, Q&A. Remember, you can send us your questions through any of the outlets, or you can send us an email. Okay, bondingandbeer@gmail.com. This is from Licia Jackson. What is the most important determining factor of a successful repair? Your substrate, my guy. If you don't know what you're bonding to, it doesn't matter if you know what happens to the occlusion. No. You need to know what you're repairing. I've been stressing this. Okay? You need to know what you're repairing. So the composition of the substrate is extremely important. That's your answer, Dr. Jackson. Let's see. Dr. Kevin Grenier. What factors do I need to consider when deciding whether to repair or replace a restoration? Well, how long the restoration been in the mouth, the clinical assessment, if the fitting of the restoration is fine, if there is no leakage. So many. You got to do a thorough clinical assessment. And that will, when you see something that is kind of wonky, it's time to change. All right? We need to redo or change. Okay? It all depends on what you're able to assess. But the clinical assessment is the most important component. Okay? Now, my third question is from Neve Odling. What motivates you? That's a great question. Motivates me to do what? To do bonding and beer? Well, sharing with Jeremy, the producer. We have a meeting every week where we talk about the outline, and then we have a beer every other week while filming this. What motivates me in my job? The travels and what I do here at Bisco. Being able to move the needle towards a better dentistry. If we are able to move that needle just a little bit to make someone's dentistry just a little bit better, mission accomplished. That's what motivates me. That's what gets me out of bed and come to this job with the best attitude possible. Is how many people are we going to impact today so we can help them make a better dentistry. Okay? It's not about me. It's not about Jeremy, the producer. It's not even about this podcast. This is about you guys. This is about what you can do. We don't see what other people see. We're not looking for what other people are looking, which is followers and monetizing and any of that. We do it because we like it. We do it because we feel there is a possibility to share information that is valuable. But most important, we've gotten, a lot of feedback from people that tell us, hey, thank you for doing what you're doing. I changed my protocol. You guys had an impact on what I was doing. It made me do a little bit more research. and now I feel more confident. That alone is motivation. And that about wraps it up for this episode of Bonding and Beer. Be sure to like, to comment, to subscribe. You already know all the outlets, okay? Thank you for tuning in to Bonding and Beer. My name is Rolando Nuñez. And thank you, Steve Austin. Not $6 Million Man, but Steve Austin, WWE superstar. Let's freaking go. El Segundo. Fantastic job, my guys. Fantastic. Let's go. Oh, I'm sorry. Where is this from? Isn't this from California? You've seen it in stores. Are you double checking on that? That will be a great add-on to my everyday beer on my fridge.